So with all of that said, we're going to go ahead and get started. I'd like to thank you all for joining us for this webinar. We're going to go through the new template that you will be reporting on. The one we are using is a dummy template. You will have a production template. In fact, all of you, someone from your health center should have received it at the annual conference, or you will be receiving it through the mail. If you have questions about the production template, at the end I'll give you the email address where you can send your questions. We are working through reprogramming that's unique to each health center if you have questions or comments or something isn't working for you on the production version. So I'm going to start off. This is our template. The first tab is noted as Overview and Instructions. You can see that we've given an overview of this program. This is the medical encounter version. There are 4 templates. The 4 templates consist of physical health template, behavioral health template, a PCO template, and a dental template. You will receive all 4 templates for your reporting. You need only to report on those templates for which you have business. For instance, if you don't have dental business, then you wouldn't submit the dental template. You would just ignore that template. Next in this overview and instructions are the instructions on filling out the tab. And you'll see behind this we have several tabs in yellow. Yellow means you're able to enter information. If I click away from this template, this tab, you'll see it's white. White means you're not able to enter information in this tab. So step 1, and we'll talk through this when we get on to the next tab, you're going to enter your 9-digit MPI number, and that will activate template for you to work, for it to work for you. You need to navigate across all the tabs. We'll explain how you know what tabs to use for your business. You will also have comment boxes, again in yellow, that you can enter information into. We ask that when it's completed, we've given you a file naming convention. You can see in this case we're working on medical encounters and specifically physical health choices. So we're naming this one PH. If you're using behavioral health, you name it BH. If you're using dental, it's dental here. If you're using PCO, you name it PCO. Then the 4-digit year and the 2-digit quarter. To be sure we're all getting the same quarter, we've given you the quarter chart down here so that you can look to see what time period you're reporting from and connect it to the quarter. So for the quarter right now that we're working on, it is the July 1 through September 30 quarter. So in this instance, it would be 2015 Q3. You're then going to put your full 13-digit MPI number. That's your 9 digits plus the 4 digits that you're reporting to, and I'll explain that on the next tab. And then the version that you have. This allows us to track versions if you need to make a revision in the future. In the case of everyone preparing the 3rd quarter report, it is all version 1. And as I said, if you can send in questions on the instant messenger and we will hold them for later, or you can jot them down and we'll open the lineup for questions later. Okay, so we're going to jump to the next tab. This is the first yellow tab. So you can see this one's yellow, which means you can enter information on it. You will also see there are a combination of yellow and white cells. Anything that is yellow is able for you to enter information. So the first thing you would do is put in your 9-digit MPI number. In this case, my MPI number is all 9s for my location. And you'll see that when I do that, it gives me the PA Department of Human Services. In this instance, we have programmed in a couple different site locations. For the FQHCs, this will already come pre-populated. You won't have to choose a service location. In fact, it'll say NA if you should happen to click the drop-down box. Because this is for both FQHCs and RHCs, some of the RHCs report by service location. So we do have this active for an RHC in their business. So as I said on the previous tab, you need to populate your full 13-digit MPI number. That comes from your 9 digits here plus your 4-digit service location. So if I were preparing this for submission, it would be the 13 digits are the the 9, all nines, 0001 would be my number. We do ask that you use the service location that's pre-populated for you here. That's the location that we make payment to. Next, you'll see your PPS rate. Again, these are all white cells. They're pre-populated, and your address is pre-populated. If any of this information is incorrect, you should notify DHS, and we will work to get it reprogrammed. You can see to the right of it, we have a box for contact information. This is the person that you want us to contact with questions related to this cost report. So for this demonstration, I'm going to be the contact person. You would enter the title, their phone number, and please remember to include their email address. We are trying to work with everyone via email. I don't know what happened. Apparently the screen just went blank. Give us a moment. There we go. Okay, and remember your email address. In this case, it's mariperez@pa.gov. Next, we ask that you put in the report starting period. Since everyone is working, most people are working on their third quarter report, that would be July 1, 2015. You can type it like this, and it'll populate the report end. You can type it 07/01/2015, hit enter. It will not allow it has to go in like a date. So you can do it either type out the full name of the date, or you can type it out with the slash marks. In this case, I typed out July 1/15 and it went to 7/1/15, but when I added it without dashes, it didn't accept that. So be aware that you have to put this information in the date format. Next, I'm going to choose a different site here so you can see. We're going to choose the Strawberry Square site. You'll see in the center section, which is provider reporting eligibility, we have the listing of MCOs. We have looked at prior period reporting and we've turned on or off the MCOs. Green means go, red means stop. So where you see a green highlighted MCO, that is green for go and you can report to them. If you see a red, that's red for stop and you cannot report to them. If we would not have had one turned on that you have reporting for, receipts and counters, you need to contact us so we can have this turned back on for you. Next, you'll see a comment box. This is general comments. What we're looking for in this specific comment box is comments related to the overall health center. So for instance, if there's a terrible snowstorm one of the weeks in the quarter and encounters were down, you would put that here. So we're going to put snowstorm, encounters, went down this quarter. I know a lot of you report on the specific MCOs, things that are happening. When we get to the MCO tab, we'll talk about how you can enter information specific to an MCO. You then want to read and certify the provider certification. You click on the little box and it'll put a check mark. Next, we have the administrator of the FQHC. This is similar to signing worksheet 5. Whoever has the authority to attest to the documents that you're supplying, it may be the same person, it may be a different person, that's the information you put here. So I may have prepared this and I may be the person in your organization that's able to attest to the financial and encounter information. It may be somebody other than me, so we're going to put someone other than me. In this case, John Doe is able to do it. He's the CFO of Health Center. The date he is attesting, you'll see we also put the date down here in the left corner, but maybe he's attesting a different day prior to your submission. His phone number and his extension. Again, this may be the same person. It may be a different person. This is the person that has the authority to attest to the information contained on the reports. Okay, so in this instance, I'm going to go back here to the middle to show you what MCOs we're able to report to. In this case, we have a contract with Aetna, we have a contract with Keystone, and with United. So if I click on the Aetna tab, you will see at the top we have FQHC name is Department of Human Services. This is Aetna, and our reporting period is the third quarter written out. Now we're asking you to report for all 3 months together. You can do that 2 different ways. We would like to see the total number. So if Aetna had 20 physician encounters for the quarter, you would put in 20. If you feel more comfortable putting it in the number for each month, you can put in 10, which would be for July. Sorry. You can put the plus sign. We'll say 5 for August and 15 for September. So in this case, they would have had 30. You can do it either way. You can type the 30. You can do it with the formula, however you feel is best for your health center. When we review it, we will simply look at the 30. You can continue to enter your information for the rest of your practitioners. And I'm just using dummy numbers here. When there is a blank, we recommend you put 0. That tells the reviewer that you did intend to leave it blank. And so in this case, you'll see when I enter all the information for the 3 months, it comes up to 119 encounters for Aetna. If you should have another practitioner type that's not listed here, we give you an other line. You are able to type into the other line. In this case, I put in a licensed clinical social worker, and I'm going to add the encounters for that individual. If you do not, this simply stays blank, and you do not need to put a 0 here. We're only really looking for zeros in the ones that are pre-populated above. Okay. Claims payment is listed below. We have 3 different types in another box. We have capitation payments, case management fees, and fee for service. Generally, we see capitation payments and fee for service. We do see some case management fees. If you have other, you would have a block to type them in and enter. In this case, we're going to put in $1,000 in capitation and $500 in fee for service. Again, we recommend that for the pre-populated lines, you put in 0 when you intend to leave it blank. That tells the reviewer on our side that you didn't skip anything and you did mean to leave that line blank. So in this case, we have 129 encounters for Aetna total for the quarter, and we have $1,500 total for the quarter in payments. The next block is informational only. We're asking about information on denied. So all you need to do is simply read the question and make a selection. Did you experience encounter denials or adjustments during this reporting period? You will see a drop down for yes or no. In this case, we're going to select no. That's all that you need to do there. If you select yes, yes will not let you leave the next line blank. You need to tell us how many. So if I were to put 0 in the next block, it will not let me put 0. It must be a number, a positive number greater than 0. If I put 1, I'm then able to continue. We recommend if you populate this box with yes and a number that you give us the reason why they're being denied or adjusted in the narrative box. Also, this narrative box, I'm going to make it a little bigger. This narrative box is specific for issues that you're having with the specific MCO. So in this case, it would be Aetna, and we're going to put a reason for the denial in here. and it's going to be provider not credentialed. I can go back and change this to no. I can then remove the number. So if I did it by accident and I now want to change to 0, I can make that change. Okay, so that's our reporting for Aetna. We would go through and we would report for Keystone, who is an active MCO, and United also. If I'm not being careful and I click on UPMC instead of United, you can see UPMC comes up with a red ineligible to report error code at the top. If I continue to not be careful and I start to type my numbers in here, you will get an error message. It says you're not able to make entries into this sheet. Remember, red means stop. So where you see red, that means stop. But we have programmed these so that you're not able to make a selection or enter information if you're closed off to that MCO. And that this is the same across all the templates, whether it's PCO, behavioral health, or dental. Okay, last is the summary report. You will see the summary report is white, which means you don't enter any information in here. You will see what the information we put on Aetna is populated. We had 129 encounters total, and we had $1,500 in payments total. In this case, our site's PPS rate is $155. So our payment should have been $19,995 for Aetna, and we only received $1,500. Essentially, we would add then Keystone and United to our number to come up with what down here in the bottom right-hand corner is what your settlement is due. So in this case, with no business from Keystone and no business from United, our payment would be $18,495. Now, if someone's not being careful again and they come in here and say that 129 should be 130, and I start to type, it will not let you. This is a protected sheet. You'll also notice that all your red MCOs from the beginning tab, so all your MCOs that are listed as red on this tab, are grayed out in your summary report. So even if you were to report on Health Partners, it would not pull into our calculation here because Health Partners is locked out. Now I want to show you what happens. I have a site that's open. I'm going to go put information into that provider, that location. So we're going to go to we're going to go to Gateway, and we're going to put information in here. So we just put information in for Gateway so that I can show you what happens if you would accidentally put information in and not mean to. So I'm going to go back and I'm going to change to the Strawberry Square location. So you can see now Gateway is locked. If I go to my summary tab, you will see that Gateway is red. And there's also a red error message, and red means stop. So you can see that the information I put in Gateway did not add to the Aetna amount because this location is not able to bill to Gateway. So if somebody should happen to accidentally get in there and put information into Gateway, it would not pull into the summary report, and it would also notify the reviewer that something is going on here because Gateway is red, showing you which MCO was populated by accident, and the error code tells you what's happening. Okay. I do want to show you that for a closed MCO, so if I'm making the correction, I can go in and delete the data out. There is one element you're able to report in a closed tab, and that is your denials. So even though the tab is closed, you are able to report on denials or adjustments for this MCO. So in this instance, I do have a denial from Gateway. I had two, and the reason being, and I'm just using this as a theory, no contract. No contract is the reason. This is just hypothetical, a reason why those errors would have occurred. Now I do want to show you, if you click to the summary report, that information gathering is pulled up here. So in this case, we had 0 for Aetna denials or adjustments, and we had 2 for Gateway. So this is giving the reviewer who's looking at your digital submission some information that they need to go back and see what's going on in the tab so they can read why you're getting denials or adjustments. You should use your best decision making in determining whether you should submit something as a denial. When we're saying a denial, we mean a claim that will absolutely never get paid by the MCO. If you have a denial that's happening and you know you're going to get it changed and corrected by the MCO, that's not what we're looking for here. We're looking for a denial that will never get paid. So if the denial happens and you know you're going to work it out with the MCO and they're going to pay you, that's different from a denial that you're really never going to get reimbursed for. I do want to just show you one other site so you can see how they're switched differently between where you may be. For the PCO template, we did use your county and the PCOs that were doing business in or around your county. So we do know that as you look at that template, we may need to turn on and off some MCOs or PCOs for you that are doing business with you. But in this case, if I change to our health and welfare location, you can see it has a different provider location. We were looking at 0001 in the beginning. Now we're looking at 00029, and the rate has changed for this location. So we're really giving you what you need to do to review if we have what's correct up front in the first page. You'll also see that in the prior location, Aetna was open. Now Aetna is closed and Gateway is open. Keystone was open and now it's closed and UPMC is open. So you want to make sure that when you get your template and you open it, and remember you must use your 9-digit MPI to open it, that will show you what MCOs you have available to do business and input information. And again, one last reiteration, the box on this page is for overall what's happening with your health center. The specific comments or concerns for an MCO should be on that individual MCO tab. So I think we're ready to open it up for some comments. And I wanted to point out here, because I switched locations, you can see because Aetna is now closed, we go back to having that same red issue on the settlement report. So I think we're going to open it up for questions. I do want to remind everyone that this is being recorded for future use and future review. So just so that you're aware of that when you ask your questions verbally. I don't know, did we get any? We didn't get any through IM, so.
I have one question. This is Stephen Sanders at Covenant House.
Yes.
I noticed this quarter's reports are it's not mandatory that we submit electronically. I'm wondering.
It is not mandatory for this quarter. It will be mandatory starting in the next quarter.
My question is the deadline moved back for this quarter?
Yes, you may submit by the end of October, and if you need more time, you can send in a request to that same email location for an extension.
All right, thank you.
Yep. Another comment that I wanted to make that I forgot to say is at the end, if you're having concerns or questions, you can click on that email in the first tab. It will pop up an Outlook email for you, and you can send your questions to that, and it'll get to the right person.
Hi, I have a question.
Sure.
How do we handle the NPI when we have an NPI for each separate site?
Do you mean NPI or MPI?
NPI. Because you're saying we need to
nobody
enter
should.
the, oh, it's an MPI.
It's
I
your
see that now. I
Medicaid. It's your
apologize.
Medicaid provider ID.
Yeah, I
The
was
one
thinking of
issued
the
through Promise.
NPI.
No.
Okay, thanks.
Yes. And if you have multiple sites, you would have the ability to choose a service location. So your 9 digits will pop up a service location. Other questions?
I do have a question. You mentioned the email address, but I did not hear you give it to us, and I cannot see the presentation.
Okay. The answer is the email address is financial spelled out, gatekeeper with no spaces, at pa.gov. Financial gatekeeper at pa.gov.
Okay.
Okay. And it is on the templates. If you haven't received your templates, you can also send a request to that email, and we'll send them out to you digital if you're able to accept them through email.
Okay, very good.
Other questions? So I'm going to say again the email one more time. You can send questions that you think of as you're working through the templates, a request for the templates, to financial spelled out, gatekeeper. There's no spaces. It's financial gatekeeper at pa.gov. And we will be sure that the right people get a response to you. It is very important once you're also going to submit your files. One thing I forgot to say, you're going to submit your files to that email. You want to make sure that you save them to some location that you're able to retrieve them on your system. There's no automatic send. You have to save them into your system first under the file name and then put them into the email to send to us. They don't automatically send when you click that button. Okay, well, we thank everyone for participating. We are going to give a copy of this instructional webinar to PACHC. So if there was others that you know of that weren't able to attend, you can reach out to them and they will send you a copy. I think that it's an MP4, so they can review it at their convenience. Thank you.